Hello, welcome to my YouTube channel. Today we are going to discuss about ectopic pregnancy. So the question here is, Miss Zoe William, 19-year-old, came to the hospital with lower abdominal pain. Her pregnancy test is positive. She needs to be admitted into the hospital for further management. Talk to her and explain about her further management. So the tasks here are brief history, explaining the diagnosis, explaining the management, and addressing the patient concerns. So in terms of data gathering or history taking, you have to ask about presenting complaint plus OBG history. Hi, Miss William. I have some information that you came to the hospital because your tummy was hurting. I would really appreciate if you could tell me a bit more about that, and then establish about the abdominal pain and follow the Socrates. Site, onset, character, radiation, associated symptom, which could be diarrhea, vomiting, sickness, PV bleeding, and temperature, any discharge down below. Any exacerbating and relieving factor and severity. Then you have to ask about past medical history and the past surgical history. When you are going to ask her about gynecological history, you need to be very careful and give a warning to the patients. Miss William, I'm going to ask you some personal questions about your periods, about your sexual life. Will that be all right? Thank you very much. So, can you please tell me, when did you have your period for the first time? Okay. And are your period regulars? Okay. Do you feel any pain during your periods? When was the last time you had your period? By any chance, have you been pregnant before? Did you have any miscarriages? I'm going to ask you a question about your sexual life. Miss William, are you sexually active at the moment? Okay. And do you have any partner? Are you in a long-term relationship? Do you use any protection during your sexual intercourse? Okay. By any chance, do you use any contraception? Okay. Have you ever had any discharge down below? Okay. Have you ever had any sexually transmitted disease? Any problem with your waterworks? Social history is very important here because you have to treat the patient, manage the patient, and contain the patient psychologically and offer social support. So you have to ask, who do you live with? How is your relationship with them? Is there anyone you can confide in? Do you smoke? What about drinking alcohol? Have you ever taken any street drug? And what job do you do? Or what do you do for a living? Thank you very much, Miss William, sharing this information. We have done your urine test, which shows positive pregnancy test. I would like to feel your tummy and check your physical observation, including blood pressure, pulse, temperature, your breathing, and oxygen levels, if that's okay with you. Thank you. Much appreciated. Now you have gathered the data. You have done the physical examination. You have to check patient understandings that what's going on. After checking the patient understanding, you will be making a summary statement. So, the information that you have shared, findings of examination, and the urine test results show that you probably have a condition called ectopic pregnancy. Have you ever heard about that? It is essentially a pregnancy outside of the womb. Our womb is connected with ovaries via delicate tubes. Usually egg and sperm meet in the tube and once fertilized roll into the womb to continue as a normal pregnancy. In case of ectopic pregnancy, fertilized egg stays in the tube and start to grow, as the tubes are narrow and slender, not designed to withhold pregnancy. So, as the pregnancy advances, it puts pressure on the tube lumen, causing pain and discomfort, and in some cases, tubes are ruptured, causing massive bleeding and putting your life at risk. Is that clear to you? Now, we have to discuss management. So, as a part of management, Miss William, we are going to admit you in the hospital. Ectopic pregnancy is confirmed with special scan called transvaginal scan and is done by the specialist. So it will be done in the morning when specialist is around. Meanwhile, we will keep monitoring your physical health and vaginal bleeding. So what is the treatment? First needs to once ectopic pregnancy has been confirmed with ultrasound, we will be doing a serial blood test, repeating every 48 hours to check the level of a hormone called beta HCG, which is a hormone which is present in high levels in a pregnant ladies. So if the levels are going down, we will wait and watch. It means that the pregnancy is dissolved on its own. If hormone levels are going up, which means pregnancy is growing, we will give you an injection called methotrexate, which stops pregnancy from growing up. If methotrexate does not work, then we must remove the pregnancy via surgery, which could be either keyhole or open operation, depending on the bleeding situation. Is that clear to you? So it is very important to address the concerns of the patients and they are not essentially toward the end of the stations. As you are going through the stations, patient will be asking questions and you have to address their concern there and then. So in these stations, patient is concerned about the admission and also about the confidentiality. She does not want to disclose this in front of parents, and if she's going to be admitted, she's scared that her parents will find out. So please offer confidentiality. Miss William, let me reassure you, whatever we have discussed about your condition and treatment is confidential, and we will not be shared with anyone without your consent except our professional team who is involved in your care. As we discussed that sometimes this condition can cause you severe bleeding and put your life at risk, so it is very important to admit you in the hospital. Miss Williams, this must have come as a shock to you. You might need someone to support you through this difficult time. We urge you to contact for support and speak with somebody you feel comfortable confiding in. If the patient asks about the complication, let them know, yes, there are some complications. There is a risk of having another ectopic pregnancy, miscarriage, and sometimes very rarely can cause infertility. If the patient insists to speak to the consultant, reassure her, yes, sure, you can have a word with my consultant. She's busy with other patients at the moment. Once she is done with them, I'll let you know. Do you have any other concern? Thank you very much.